Well, it's our first class, our first 7 a.m. class this morning, and woke up bright and early at 6 a.m., which doesn't really seem like that early for some, but for me, I'm not exactly the best morning person. But got up right when my alarm went off and trying to get ready for our first 7 a.m. class here at the gym in Little Hamburg, Buffalo, New York. So it's been a really long time since I've actually posted about my surgery, and what brought this up was actually someone in one of the mom groups was asking for either opinions or solidarity or, just some feedback about the surgery. So I just figured maybe this would be a good time while I had a few extra minutes to kind of give an update on how things are going. So in the past, I've always mentioned, talk to your doctor about other options. There's something called ablation. So if you have really heavy periods, sometimes that can almost stop your periods. It's literally the burning of the inside of your uterus. And to me, that didn't really sound like an option just because it would have created more issues for my endometriosis. A lot of doctors will push for that. But because I know my body and how much it would react to the scarring, that was not an issue. So if you have endometriosis and they mention ablation, definitely talk to them about how the after effects would happen to you as a person and not to the general public. And it's just because I didn't want to go that route. And they'll also push for medication. Me personally, I would get really suicidal when I was on birth control. I do have mental illness that runs in my family. So for that, it was definitely not an option again. Besides the pain in the butt of taking a pill every day at the exact same time, and then having the after effects of getting off of it. I just don't like the way that it reacts with my body, period. And I didn't exactly want to be that kind of basket case, so to speak, with my daughter being around. So really my option was surgery. And now that I'm kind of past the recovery point, I started really returning back to the gym full force just about 3 weeks ago. This recovery has been longer than any other recovery I've ever experienced. And I kind of knew that going into it because my mom number two, so my mom is gay, her partner, we call her mom number two, she had a hysterectomy a long time ago for her own health reasons. And she said that it took her forever just to be able to do a sit-up. So based on her feedback, I was like, well, she wasn't as active. I mean, she didn't lift weights. She played sports. I mean, she was a big sports person, and hell, she worked for Nike. So I kind of took her advice and kind of listened to everybody, multiple sides. And so I knew the recovery was going to be a lot longer than just my normal endometriosis surgeries that were laparoscopic. And I also had to be really careful about my pelvic floor because one of the other reasons why I had surgery was because I had uterine prolapse too. So that's when, of course, pelvic organ prolapse, or POP, and there's also uterine prolapse, is when you have your, basically your insides falling out of your vagina. So I had a level 2, which it's not terrible and it can be fixable. It wasn't the worst case, but it was just kind of one more layer of decision that just kind of solidified getting the surgery. So with the long-term recovery, basically knowing what to do and what not to do, what felt right, what not felt right, any kind of back squats, squatting was okay, but anything that was literally like sitting up or rolling off to my side, my obliques were usually okay, but my surgical scars actually took the longest to heal. I could still feel those well into month 3. So that was the biggest thing that I felt. So like I said, just recently, like within the last 3 weeks, I feel comfortable enough to be able to start going a little bit harder. I'm still pretty aware of my pelvic floor. I'm trying to learn how to relax because I still hold a lot of tension in my stomach. Like I always want to try and suck in, which ladies don't do it. It's not good. But other than that, everything's doing fine. My PRs for a lot of my lifts were a lot lower, which of course that was to be expected. But the great thing is they weren't as low as I thought they were going to be. I only lost maybe 15% of my weightlifting capacity. So for being, like for instance, I PR'd actually on my back squat because as one of the recovery exercises that I was desperately wanting to do were regular squats. So because of that, I was able to maintain some of my muscle and was able to PR afterwards. I also did a lot of walking. That's about the only thing you can do after surgery. So I didn't exactly slow down on that either. So they said only walk maybe 10 to 15 minutes. I was already up to 45 minutes well into January. Well, because I had to do something. I was going crazy. I felt okay, but I knew I couldn't do any heavy lifting. So what was the other option? Walking. So I probably did more than I was supposed to. But it felt okay, so if it felt okay, I was gonna keep going. But I guess now that the surgery is over, we're gonna start getting more into exercises, pelvic floor stuff, resources, like where you can go in order to get help. And I will tell about certain instances. I will not be releasing names because that's just awful. And plus it's, kind of against the law. So I'll be giving you like certain circumstances about, pelvic floor issues, examples that I come across. And sometimes I may even have to correct myself. So things on like diastasis recti and coning and things like that. There's always new information or misinformation that might pop up. So I'll just say ta-ta for now, and I will talk to you guys later. It's good to see everybody again.